Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning and welcome to Open Your Eyes.
Start your morning right. I'm Don Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
We're so grateful that you could join us on this lovely Thursday morning. It is a Thursday morning.
Yes, it is.
Hey, it's Friday Junior.
Right. Friday Eve.
It's Friday Eve. Some folks say Friday Junior, but that's just the way it is.
I like that.
Nonetheless, there are so many things going on across the country, and as per usual, what we do is that we normally dive into what the news was last night, and there were a lot of stories actually that we could pick on. But the biggest one out of all of them, Marlene, is that as of Monday, we're rolling back to a curfew, and it's going to be across the board. Now we're talking from 9 p.m. to 4 a.m. every day until things, I guess, would simmer, or until they find it fit, the authorities find it fit to say, you know what, we could eventually open things back up.
Yeah.
There's some backlash about it. Some folks are happy about it. But that's what made the news last night, and I think that's one of the biggest stories.
Well, of course. I think it is tied closely to the continued increase of cases that we're seeing of COVID-19, and it is getting more and more concerning, seeing the numbers rise. I think we're looking at somewhere around 50 new cases each day. Particular villages are recording as many as over 20 cases in one day.
Yeah.
So we know that there is a rapid spread going on. And even if, and because we have to be clear, the type of variant that is in the country, we don't have it confirmed as yet. The medical community has said, it's most likely Delta. It's everywhere else around us.
Yeah.
And there are other variants of concern that it could also be. But all of these variants of concern have one thing in common. They're more transmissible. It means it's far easier for the disease to spread. So we are seeing a rapid spread of COVID-19 across the country, and something has to be done.
Yeah.
Ideally, it should be that we all go out and get vaccinated
Yeah.
and really allow for some protection. But even so, if you've had your first dose, you still have to be doing all the precautions, and even after your second dose as well, to minimize the risk of catching or passing it on.
That's right. And this big news came on the heels of a vaccination campaign that was going on in Orange Walk Town, and it seemed that it was a very, very good one, a great turnout. There were lines, and that was when our reporter actually caught up with the Minister of Health and Wellness, Honorable Michelle Shabat, who actually broke the news. There are, of course, backlashes about it simply because of the economic reasons, whereby stores will now have to roll back to probably closing at 8 o'clock in the evening rather than their regular 9 o'clock hour. But at this particular point from yesterday, the numbers are this. New confirmed cases are 49. Were 49 for yesterday, and 48 recoveries, but under investigations. Now, that's the one that always gets me nervous. 108 cases, Marlene.
Well, because
108 under investigation, not cases, sorry.
And that's because contact tracing has to happen. And remember, if we recall, in the early days of COVID-19, every one person who tests positive has to then list out all the people they've come in contact with in their contagious period. And because people are moving around and you get together with your family, your friends, and your work buddies after hours, you are just coming in contact with so many more people. Imagine the contact tracing that has to take place. So, the curfew is being adjusted. I think the question is, and I think we've asked the Prime Minister, I've heard him being asked it before, about whether or not lockdown is a possibilmean. And I know that's almost like a taboo word to say at this point in time. But I hope we never have to get to that point. I hope we can get it under control. I hope that the curfew hours help us in reducing the spread that we're seeing.
Yeah.
But what we know for sure from past experience, and we don't even need the past experience. We could look at the other countries that are in their third wave.
Oh my goodness.
that are getting to some very strict measures, that hospitals will become overwhelmed. We'll see increase in deaths as a result of it. So we got to take it serious.
Indeed.
I think the head of WHO said, you know, basically, if you think this pandemic is over, you're living in a fool's paradise, because it still is very much, it has a grip on the entire world.
Yeah, indeed. Staggering numbers, though, Marlene, is coming out of the Toledo district, whereby we see one village specifically, and I've been noticing it. I mean, I'm a PG man, and I've been noticing it specifically Santa Elena in the Toledo district, I think on a third day actually, of double digits in the amount of cases that they've detected there. And that is alarming, and more so spreading to other villages. There we go with Santa Elena, San Jose with 1, and Criquejuta with 1, but the entire Toledo district with 13. They have been recording double digits every day since Monday. Yeah. And so that's some alarming numbers there.
But let me say, I know that there is a reaction, naturally. I mean, everybody, I think yesterday when we posted that there was going to be a 9 p.m. curfew, I got so many calls like, what do you mean 9 p.m.? Which day? How many days? And, you know, it's that feeling of restriction. And, you know, it has been a really hard time. But let's look at this from another perspective. I know that the call that people are having right now is to exempt the vaccinated. Yeah. That, in other words, those of us who have chosen to do what is beneficial for the entire country by getting vaccinated, we also have to be confined because there are many more in the country that are unvaccinated. Yeah. And unfortunately, until we can get everyone on board where we can reach the herd immunity that is required, this will be what we'll have to go through, which is why, you know, education, conversations, explanations, and just that constant reminder that we're not out of the woods yet. No. We're not done with this diseases yet. It is changing because it is spreading, and every time it changes, it poses an even bigger threat.
Indeed. The numbers are staggering, though. But for those of us who came out, and I'll specifically say yesterday, who came out in numbers yesterday in Orange Walk to get that vaccination. I wonder what the numbers are. I haven't seen it as yet, but there are over 100 and something thousand Belizeans who have at least gotten their first dose, which simply means that after a number of weeks, those numbers will be, yes, after 8 weeks. If you've gotten your vaccine yesterday, then you're eligible after 8 weeks again to get your second dose. Those numbers will be rolling over afterwards. We've got somewhere around 48, 49,000 Belizeans who have been fully vaccinated. And so these numbers are actually, will continue to work in our favor. Yeah. But the only way we could get to herd immunity, like we've been saying, is for us to go on out to get vaccinated.
That's from Tuesday.
That was Tuesday's number. Of course, probably a little later on, we'll be putting it on our social media page. 1,918 people. That was on Tuesday. Yeah. We're up to 116,000. Not fully, but at least one dose. 43,800 something there fully vaccinated. And I'm proud to say that, Marlene, I'm a part of that. My wife is a part of that. Yeah. You know, our team here at Channel 5, we're a part of that. And so we're comfortable knowing that, you know what, we could at least, we're actually making that push for herd immunity. Yeah. I feel good about that, at least.
Well, we do have more to go.
Yeah, we do
have more
a lot
to go.
more.
And I think that has to be something that we keep in our minds as much as possible. Yeah. You know, one of the things I was talking to someone who's visiting, and they were talking about what they're seeing in the U.S. and that they're having friends who are in their 30s, in their 40s, being hospitalized with severe COVID. Unvaccinated people, because the new variants also are affecting a younger population. Yeah. And that's something we haven't taken into consideration. Because for a long time, you know, you were below 50 and you thought, okay, I'm cool. You know, I might just get like the little flu and I'll be fine.
Especially at the start of the pandemic.
Yeah, at the start of the pandemic. But it's changing. And so we have to take that into consideration. Another, I know, topic a lot of people have been talking about is looking at the move that France is doing So France, President Macron has gone the route of saying, okay, you know, we encourage everyone to get vaccinated, but now public places, transportation, restaurants and whatnot have to, you need to show what is called a health pass, essentially. And that health pass is either a recent COVID test or a vaccination card.
Wow.
And they're also stopping the free testing. So if you're going to, you know, choose not to get vaccinated and you have to get tested, then, you know, you're going to have to pay for that expense on your own.
Yes.
Some have seen it as very rigid. There's lots of pushback. Let's not,
of course,
as with all the precautions being taken everywhere else in the world. But we're seeing where countries are innovating in how to get people motivated or in a place where they understand that vaccination is our way out of this pandemic.
Yeah, but see, you know, the pushback from those who've been vaccinated would tell you that we're doing our part in trying to get the economy rolling again. And there are other people who might not see it that way. So why am I not able to go where I want to or how I want to, knowing that I've been fully vaccinated? And that's the question out there, Marlene, whereby folks are saying, you know what, at what point are we going to be, or do we have to get to, so we could go wherever we want by showing that I've been fully vaccinated? So these are the things that I think, the conversations that must be had.
Yeah, there's a lot, and we have a lot of examples where we can look all over the world to see what they're doing and how things are going. The U.S. is looking at an increase in cases, even with their high, I mean, they're higher than us, vaccination rate. And some of the states are going back to indoor mask mandates because of the transmissibility of Delta. So we are not out of this yet. And we have to keep on discussing and answering questions. The key part in Belize, we have a choice as to whether or not we can get vaccinated. And if you have questions or concerns, I keep on saying to people, ask. Don't just, I mean, you got to be careful when you go online. You find the material, you find what you want to find online. But ask relevant sources. You go to the doctor when your children are sick. You go to a specialist when you feel unwell. So talk to them and see what your risks are, whether or not it's best for you, and get yourself the information you need to make that choice.
But the ultimate information here, Marlene, and this is final for me in terms of this topic here, that we've been reported, especially at the COVID unit at the KHMH, while they're overwhelmed, they're telling us that, you know what, those who are in there, they haven't been vaccinated. They haven't been vaccinated. And in the U.S., they're telling us that 99.5% of the deaths from COVID are unvaccinated people. And so this tells a lot.
They're even calling it, it's now a pandemic of the unvaccinated.
Yeah, there you go. So these, you know, these numbers.
I mean, we could go on and on about this because, I mean, there's the whole other topic of the inequity. You know, Africa is struggling to even source enough vaccines, and we have vaccines just
for free.
Yeah, so
at all the health centers, all the health facilities, they're doing health camps across the country. But come on, man.
Yeah, we got to get into it because we actually, as you mentioned, KHMH, we are going to be talking to them this morning. We have to find out what's going to happen with the number of cases that they are seeing and how they're going to manage with the hospitalizations that is expected to increase.
Indeed.
So we got that coming up, but we got to get some motivation in to get our day started. I know some of you really look forward to it, so
everybody
won't get in trouble and skip that one. So we got our eye opener taken from dailyom.com, and it goes like this. It is human nature to sometimes lash out at others, but we can learn to navigate our feelings without losing our center. Each one of us has experienced situations where we found ourselves lashing out at someone without meaning to. We later berate ourselves for losing control and feel guilty for treating the other person badly. And while it is human nature that our emotions and moods will get the better of us from time to time, we can learn to navigate our feelings and negotiate difficult situations without losing our center. When you find yourself in a situation where you're about to lash out at the person in front of you, try to center yourself by breathing slowly and deeply. A few slow inhales and exhales can help dissipate the intensity of your feelings before they escape you. In learning to navigate around your emotions, you are giving yourself tools to feel better the next time your emotions start to boil. In doing so, you will be taking care of yourself by alleviating your own uncomfortable feelings while respecting and protecting those around you.
It happens. It happens. And I'm sure it happens to everybody. To a certain extent, I'm mindful of my feelings, especially being around people, that probably are just my associates. Those who don't really know who I am. In terms of lashing out, I love that the eye opener actually gives a solution of what to do to try and help you from being that way to people. People look at you differently, especially if they're first time encountering your feelings or you on a whole, and then that's the way you're gonna approach, or that's the approach you're gonna give. It could put a damper on who you are, and so therefore a few slow inhales and exhales can help dissipate and the intensity of your feelings before they escape you. I just love the fact that at least there is a solution there, because it does happen.
Yeah, I was gonna say you do it automatically.
Yeah, it just
you
happen,
ever get just slightly irritated in a moment, you find yourself just. I've seen you do it, yeah. But we all do it. We all do it. I think it's remembering to do it in the real high intensity, I'm about to lose my cool moment.
Indeed.
We are human beings.
Why
do we,
We've got emotions, and these things will eventually spill over at times. It's not like we do it every day, like we mentioned, we're mindful of it.
Yeah.
But it does happen every day across our country, across the world indeed. But just be mindful and make sure that you do your inhales, exhales, and be mindful of others' feelings. Yeah. Easy as that, huh? And of course, we've got to move on now. We'll be taking a look at the weather. We've got them on the line already. All right, and if we know that the weather comes courtesy Uno, and we've got Angelia on the line. Yeah. Angelia, good morning.
Morning.
How are you today?
Good, you?
Oh, we're doing good. I love the sound of your voice. You're telling me just by your voice that no rain today, huh?
Well, if we do have any showers, it would be brief, or as we call them, passing showers.
All right, so let's get on into it. The general situation, what's happening there?
Okay, we have a decrease in moisture over the area. I expect generally fair weather to prevail.
Now, that's some good news. And in a 24-hour forecast?
Okay, we expect skies to be sunny with a few cloudy spells today and then partly cloudy tonight. Like I mentioned earlier, we'll have mostly brief showers or isolated thunderstorms, and then a few more over the Toledo district, extreme south tonight.
Wow, and they've been feeling the pinch of it. But let's move on into the winds. What should we expect there?
It's been windy.
Yeah.
Yeah, the winds will be from the east and northeast at 10 to 20 knots.
Okay, and the highs and low temperatures for today?
Okay, high temperatures today will reach about 88 degrees Fahrenheit along the coast, 92 inland, and about 80 in the hills. And then the low temperatures tonight will range from 80 degrees Fahrenheit along the coast, 74 inland, and 68 in the hills.
All right. I was just going to ask you about the extended forecast. We'll do that. But let's get on to the advisories, watches, and warnings.
Okay.
Okay.
There's none right
Flood
now.
warning?
Yeah.
Isn't there a flood warning in effect for the south of the country?
Yeah. Yes.
Ah. All right. We caught you there in that one, huh? But nonetheless, all right, so let's get into the extended forecast. What can we expect for the next few days?
Okay, I expect generally fair weather to prevail with isolated showers or isolated thunderstorms developing.
All right. And tropical weather outlook, do we have anything to be watchful of?
Okay, not at this time.
All right. All right. Well, Angelia, we want to thank you so very much for joining us this morning to share with us a bit of good news with the weather.
You're welcome.
All right, there we go. Angelia Guy from the National Met Service sharing to us what we should expect. But again, with the advisories, watches, and warnings, Marlene, we know that it says thunderstorms will occur over the Toledo district tonight. We know that they've been getting the brunt of the weather in terms of the rains, and they've been having some flooding there. And it says flood warning is in effect for the south of the country.
Yeah.
Wow. All right. So now you know the hurricane season is here, by the way. We want for you to make sure that you take heed of that and make sure that you've got your hurricane preparedness plan in place for the entire family.
And
All right. So we move on. We've got a packed show lined up for you for this morning. As a matter of fact, our first segment, which of course is our COVID-19 update courtesy Fulltech Systems. We'll be taking a look at or having a conversation about the KHMH as they're operating under emergency mode during the rise of COVID-19 cases. We'll have two reps from there to tell us exactly what's going on at the KHMH.
All right, and the second part of the show, this is really great initiative that's actually been taking place for quite a long time, where municipal bodies across the country have what they call a child advisory board. So they get kids who are going to tell them how to make their city or town more child friendly.
Oh, that's lovely.
And Belize City Council is looking to refresh their child advisory board. So we're going to find out about who can apply, whether your child is eligible, and how to go through the process.
All right, and we'll be smoothing things out with our final segment with this cake decorating 101.
I sense a competition here. I think I can win this one. I think I have a bit more.
You feel?
When it comes to the kitchen stuff, usually I hand it off to somebody else. But the baking, I think we can have a challenge.
You think so?
Yeah.
We should have that. We should have that mysterious song on and say, "Will Marlene beat John in the cake decorating?"
Well, we have the owner of Sweet Little Things by Renz, who's going to be doing a cake decorating 101 with us, and so
It's going to be good. It's going to be a great one. Looking forward to all three of these segments. We've got to take a break, though, but just before we do that, as per usual, we've got our birthday shout-out.
We've
got to shout out, a special shout-out. We've got to shout out our girl, Jamie Lee Rock. She rocks. Look at those flowers. Happy birthday to you. And we're going to keep it right there because we know that you're going to get much more of those. Happy birthday to you. Do enjoy Jamie Lee Rock. We love you so much. You know that. Coming from your entire family, your Channel 5 family, and of course your Open Your Eyes family as well. All right? Enjoy your day today. We'll take a break. When we come back, we'll be chit-chatting with the KHMH. Stay with us. We'll be back.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's a fact that with Smart, you get truly unlimited everything. Only with Smart, you get unlimited data anytime. While with the other guy, it's only double data on weekends. With unlimited data every day with Smart, there's no need to wait. So, it's a fact that our unlimited plans beat the competition. Stop being measured and told when to use your data and get unlimited talk, text, and data. Experience the true unlimited plans with Smart. That's a fact. Make the switch and live smart.
Introducing Edam A Cheese, the A+ Dutch cheese to hit the Belizean market. As the name says, it is of A-class quality, the best Dutch cheese in Belize. Edam A cheese is creamier, less salty, and simply more delicious. Don't be left out. Get your A cheese at a supermarket near you. A cheese, exclusively distributed by Unitex Company Limited. Call us at 610-3626 or 610-8910. Follow us on Facebook at Unitex Belize.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. Welcome back to Open Your Eyes. And we're moving now into our first segment for the morning. Of course, this is our COVID-19 update courtesy of Fulltech Systems. A conversation that must be had. The KHMH operating under emergency mode during the rise of COVID cases in Belize. Now, in to tell us more about it, we actually have Dr. Andre Sosa. He is the chairman of the board of KHMH-A, and also Dr. Adrian Koye, acting director of medical services at the KHMH. Good gentlemen, good morning and welcome.
Good morning.
Good morning.
Thanks for having us.
It's nice to have you guys, and that much we could tell you. We know that you guys were on screen I think about 2 days ago, and we had a discussion on this. But let's jump on directly into it. We're seeing this rise. Folks are not adhering to social distance protocols. As a matter of fact, you could actually count the wait time for people now washing their hands again. We're not doing 20 seconds. What's going on with the country? What's going on? Dr. Sosa.
Well, I think that we have to look at it in the context of what is happening worldwide. Mm-hmm. We are seeing increasing numbers all over the world.
Yeah.
Even in advanced economies, that is also occurring. I guess that there are a number of factors to which this can be attributed. Mm-hmm. Certainly COVID fatigue and a relaxation of the precautions can be partly responsible. Mm-hmm. However, I think it is undoubtedly the case that with the rapid spread of the Delta variant, that is part of the reason why we are seeing the rise in cases. Mm-hmm. For us, alarm bells started ringing around the middle of July, when we saw numbers rising to where they were at the beginning of the year. Yes. We had reached a peak of 25 cases admitted at the KHMH in January of this year. Mm-hmm. And then by the middle of July, we saw those cases rising till we reach 19 cases once more.
Mm. All at one time?
No. All at one time.
Mm-hmm. Okay. So that was part of what triggered the decision over the weekend to switch back to emergency mode?
Certainly, because it required a concentration of our personnel to be able to handle the surge. Also, a need to conserve our resources in terms of medical supplies and medical equipment to be able to cope with the need to attend to this increasing number. Mm-hmm. Mm-hmm. Certainly, there are cases that are positive, confirmed positive, and there are cases that might be under investigation, but until you are able to rule out conclusively that a patient is COVID negative, yeah, you still have to take all the necessary precautions, and that requires significant allocation of resources.
Mm-hmm. That's a key part of the clarification that has to be made this morning, because people are looking and saying, there's a chart that says how many people have COVID and are hospitalized, and that doesn't match what KHMH is reporting. But what you want to explain this morning is what you call the PUI, persons under investigation. Let's talk about the numbers that you're seeing that you treat as if they have COVID.
Okay. Good morning, and thanks once again for this opportunity to share. And I just want to thank my staff again for the amazing work that they're doing. And so our shift last night would have had 2 nurses on the COVID and 2 nurses in the PUI area. Mm-hmm. 2 doctors for one and 1 doctor for the other. And this represents a very scaled down approach to managing the same problem. Mm-hmm. Because patients under investigation really are patients that we assume have COVID until proven otherwise. So when you look at numbers purely as, oh, there are only 5 COVID patients, but at the same time there are 7 or 8 patients under investigation, the burden is actually double, or sometimes, well, often double. And so it's the same formula, the same approach that has to happen for both categories of patients until we prove them otherwise.
the same level of care,
Absolutely.
except that one has a confirmed COVID positive diagnosis and the others are pending.
Are pending.
Yeah.
Yes.
How long does it take for a person under investigation to be confirmed as COVID-19?
It can be easily within half an hour where a rapid test is positive.
Okay.
However, we do await a PCR test, which is a determinant and is our gold standard to say that this person truly is positive. And with that, sometimes a day and a half or even 3 days.
Wow.
Okay, so it could be anywhere from 1 to 3 days before that person is determined to be COVID positive versus person under investigation.
Yes. And to be fair, it can be even longer. There are a number of circumstances that are associated with that. So for example, even a PCR negative may have a false sense of security for people. The factors that influence that is how the sample was taken and timing of when it was taken. So a patient may still persistently not be well, and we have cases like that even now, where the imaging, the radiologic imaging, CT scan, etc., would suggest that this is COVID related, but all these serologic things, or well, these different tests actually has said otherwise, and we have to retest them. So this is the expertise that has been fine-tuned by our staff, led by Dr. Bradley and Dr. Cruz and all these other doctors and nurses, because again, it's a team approach where the eyes are sensitized to really the variations in which this presents. And therefore, COVID is not a cut and dry thing. It's something that we know some things about, but the reality is there's a lot that we don't know. And this is the whole world with the brightest looking at the same problem, still in a quagmire about things, especially those who get COVID have mild symptoms and think, well, I'm off, I'm okay. Actually, you may not be so okay. And that's our next epidemic. So our long COVID problems is just going to be another major burden on the health system.
That's a critical point, because I do want to come back to that, because you know, the science is emerging now in having us understand that. But just going back to the rate as to which the people who you have untreated under investigation, how often are they confirmed as COVID positive?
Again, that's a very nice question, but it's a reflection of what's happening in the society. So if we have lots of numbers, like right now, we are seeing that we're in that third wave by way of our hospital response. But we see that the numbers are there. Then the chances are patients who are under investigations for the classic symptoms and other atypical symptoms, you would get a reward of positivity, maybe 1 in 20 or 1 in 30. Early in this year or towards the end of last year, maybe as much as 50% of patients, the same patient under investigation, would have come back positive. We don't want to see that. So we're happier that we catch one or so at a time, and that is just then part of our justification for us to maintain this level of vigilance.
A part of it too, and perhaps you can help us understand, is that with the new variant, there are different symptoms that are used, that are being recognized at presentation. First, we were looking for the loss of taste and smell and headache, but what they're saying now with Delta is that it's different.
Yes, it seems that it might present with more symptoms like a cold, sneezing, coughing. So persons might sometimes mistake it for the case of a common cold. And days pass by without seeking the necessary assistance. So yes, that is part of the confusing and changing scenario that we are facing.
And a common cold, you know, it's scary to make mention of, because even during the pandemic, there were a lot of people who were still getting the flu, especially at its height. And then now to know that, especially with these variants, you're actually getting the symptoms comes across as, you know, somewhat your regular flu. Now that's very, very scary, because one of the things that people like to do is that they still move around without using a mask, even though they feel that they've got the flu symptoms. I wanted to come back to the point of the after effects. What are we seeing the after effects of these things right now? And what are some of those that you could share with us?
You could classify the after effects in two ways. One for the health professionals, because, and then of course one for the actual patients and then their families. Because the reason I put it that way is that more than 1 year now we have a sustained battle, and we struggle to accept the simple concept that COVID is real. COVID, there is no cure for it, right? There is no cure for it, and we just don't know, like we're saying, what the true after effects are. However, where it comes to our human resources, and globally it's the same thing, there is that fatigue, there is that weariness, and there is a lot of psychological impact, depression, and I guess post-traumatic stress disorder. And the fact remains that as we are in this third wave, we are asking the very same people who saw the worst of it last year to go back in and fight again. This is very hard to watch and very hard to be a part of, but it is a necessity. The battle is not Karl Huschner. The battle is everybody. Everyone has a responsibility in this. It's a primary care battle, and that message really has to get out there where it comes to that. Now, patients who were cared for and were herded, for example, in these COVID units, etc., around the world, and similarly us, a lot of them, and their stories really you have to get at, because they're the ones truly traumatized, disconnected from their family, you know, seeing others die next to them in some instances, and that's something you don't have a book and say, I'm going to experience this, I'm preparing myself, and this is going to happen. No, this is life right in your face, in many ways, life and death. And of course then the families suffer. Of course there's always the financial part and economic burden, the bills that they end up saying, oh, Karl Huschner has a bill and they're chasing us down. And to put things in perspective again, if you're paying $300,000 for private care at Karl Huschner, you may pay $0. Some people can't pay that, and that's the reality.
What's the cost of hospitalization for COVID-19 at KHMH?
There is
it can run into the hundreds of thousands at the private institutions.
Yes, but there's no real way to define that. It's not fair because the burden goes beyond an actual number. I mean, it has to do with who else has been cheated. So even though COVID is there, it's inserted itself. We still have cancer patients, trauma patients, the MIs, the strokes. That has not stopped. So we have one ventilated COVID patient right now, but in our adult ICU we have 5. In our NICU we have 3. In our pediatric intensive care, 1.
For other non-COVID related illnesses.
For non-COVID related. And so what Dr. Sosa was talking about, resources, you know, we have to find the resources to mount an intensive care battle that is twice the size of what we were doing before, with probably the same resources.
Look at it this way. The government is providing vaccines free of cost, and an AstraZeneca vaccine will cost you about $10, shall we say. It costs us on average $400 to $700 per day to treat a COVID patient.
A COVID patient.
A COVID patient. And of course, the cost can escalate depending on the amount of time the patient spends in the hospital. Yes, it can be many tens of thousands of dollars at the end of the day, and as Dr. Koy is saying, these are resources that are also needed by other patients. So if something is preventable, precisely. So if something is preventable, those resources could be used elsewhere. Let's look at our cancer treatment unit, for example. We've seen upward of 800 consultations, and it is something that certainly needs more investment, but every time we have to take away from all the other things because of COVID, that
it doesn't go towards cancer
treatment. It's unfair to the rest of the population. We've had to suspend outpatient clinics. Again, that's unfair to those patients who are awaiting surgery, patients who need to see their specialists. And it also comes at a cost to the institution. For every day that we suspend clinic, it's about $3,000 of loss of revenue to the hospital, revenue that is sorely needed, especially in these times of financial constraints.
Yeah.
But
this is. Go ahead.
I wanted to, because you know, I'm glad that you you touched on that, because I still think that there are folks who might not understand the situation that KHMH is in with respect to the emergency. So I'd like let's dive back into clarifying what KHMH is meant when it says that, you know what, we're operating under emergency circumstances at this point. What do we mean by that?
Well, it means that we have to pool our resources. Bear in mind that there is a limited number of staff to provide care for these patients. Bear in mind that there are severe supply chain constraints because we are competing with other countries for limited supplies of anesthetic medications, ICU type medications, PPEs, and so on. We can't put our staff in a situation where they don't have the necessary protective equipment. We don't want a situation where patients get less than the necessary and minimum level of care because we don't have those medications. That's why we've had to hold back on everything else to concentrate on dealing with this emergency situation. We are hoping that we will be able to reopen outpatient clinics and elective surgeries and so on, which are already quite delayed because of the backup from COVID. And this is a situation that is not unique to Belize. It is a problem all over the world.
We've seen hospitals that the entire hospital became a COVID hospital because when they got overwhelmed. And I don't think maybe we've allowed ourselves to forget when you saw people in hallways and outside of the building waiting for care. But let's bring it back to one of the critical matters, and that is that we are past a year of facing COVID. And I think the primary question from the public is that should have given us as a country and KHMH enough time to be even more prepared for this third wave. How do you respond to that?
It's a historical problem. It's a legacy problem. The KHMH is owed $35 million of fees for services provided in the last several years. That is money that could have been invested in personnel, in equipment.
By patients or by government?
By patients.
By patients, okay.
So that's the first big issue and problem that we are facing. And it is something that we will have to try and remedy once and for all to lead us to the state of preparedness that can help with COVID and with whatever comes next. But again, that is not too unique to Belize. I'm not making an excuse. But
and in the past, it's been written off.
Yeah, we can't carry water in a basket, as the old saying goes. And that is what this present board is looking to do, to make the necessary changes to recoup as much of the money as can be recovered and to make the pertinent investment. But the investments are not only investments that the KHMH authority needs to make, they are investments that the country as a whole needs to make. Investment in training the necessary personnel. We need more doctors, we need more nurses, we need more lab technicians, we need more x-ray technicians, we need more physiotherapists and so on. Dr. Kohi was making the statement and the analysis that in losing some of the staff that have recently resigned and left the country, we have lost a generation of skill acquisition. We have lost substantial parts of the teams that managed the first and the second COVID surges. So, you know, it will take a time, it will take a while to rebuild that skill set. And that is why it is so very important that we are able to rely on endogenous resources, people who are more likely to stay with us and to build up that culture, that medical and nursing culture, and that they will be able to pass on to subsequent generations. So it is a legacy situation.
Agreed. And you know, I think the problems that have plagued KHMH have been ventilated multiple times. You know, somebody might go and lose their life and no one ever goes back to pay the cost of all the surgery that they took, all the emergency care. And this has happened for a very long time. But let's look at just COVID. How many patients can you treat at one time?
Well, we have total capacity for 36 patients, both COVID and PUIs.
And that, I was going to say, that includes people who are confirmed COVID and people under investigation, still waiting to confirm.
Yeah.
36 in total.
36 in total.
How far have we, what's the largest number we've seen so far in this particular wave?
So the largest number of COVID positive plus PUI is about 15.
Okay. Wow. And do we have the human resources for 36 beds?
The best answer is no.
No.
No one has that.
It's the reality.
Because even in major hospitals in Guatemala City, for example, they're max at 16.
Yeah.
The most we've ever ventilated during our COVID peak was about 15 patients for COVID. And that was at a huge cost. So we have to be honest with ourselves. Yeah. No one is going to be prepared.
Yeah.
No one needs to see this. No one needs to prove that we can manage it or not. We just need to prevent. The message is we really need to prevent.
What's it like for you? Yeah. Knowing the realities at the hospital, having seen the patients, when you see and hear of people resisting or being hesitant to get the vaccination?
It's quite perplexing, but I say that everyone has the right to be wrong. We would prefer that they be right. But I will illustrate with an example why it is important to be fully vaccinated.
Okay.
Of all the numbers, we had, I think, about 5 persons who had the single dose and who got COVID, clinical COVID.
Okay.
And it makes the point that if you have your 2 vaccines, your 2 AstraZeneca vaccines, it is very unlikely that you will have symptomatic COVID. And I want to bring the message that if you are at least 8 weeks into your first shot, go get your second shot.
Yes.
Particularly with the advent of the Delta variant, it is very important that you get your second shot. The cases of persons with COVID, clinical COVID, who were fully vaccinated are very limited in Belize. I think we had 2 cases, but those were patients with cancer, and which
so
obviously made them
immune system.
Yeah, very especially vulnerable. But normal, healthy people per se, I don't think that we have any documented cases. I stand to be corrected if that isn't the case, no?
The CDC has called this a pandemic of the unvaccinated. In other words, the people who are in the hospital getting very sick, people who are losing their lives, are those who have not taken the vaccine. Another change that we've seen with this particular wave is the demographic, and that's what I want to find out from you. Are you seeing a different demographic of persons being hospitalized with COVID-19, and are you seeing any change in the severity of the illness?
Okay, I can account for the fact that yes, we are seeing more younger population.
Younger,
that are,
like?
well, in the 20s age group. And we've had a few pediatric cases for the year, and we've had many more pediatric cases under investigation presenting with diarrheal type of illnesses, because that's something that we look out for in them. So we've seen that as an upsurge, but converting that to positivity is still quite low. In terms of the severity, again, it gives a loose assurance.
Because is it what we saw before, or are there different elements?
I think it's different, and we can't really account for the factors.
Okay.
It may be, and we keep saying about one variant, and I just want people to have a different view of it, is that there will always be mutations and variations.
Okay.
It don't matter what name they have.
Yeah.
The reality is that we have to conquer the virus in the ways that we already have. The strategies we have already, we don't need to prove it again. We just need to execute it.
Yeah.
Because the viruses mutate. It doesn't matter, and it needs us to transmit it one to the other.
Yeah. And we don't even know which variant we have in the country. We think it's Delta, but they've detected several.
There are probably many.
And there is I cannot remember which one it was, the one that we saw in Brazil that was affecting children as well. Which one is that?
I think that's the beta.
Is that the gamma? The beta? Well, one of the variants. Yeah. But we know that some of the new variants also severely affect children. And we don't know specifically all the variants that are in this country as yet.
No.
So you are seeing pediatric cases of hospitalization.
Yes.
But not severe as yet.
Not severe.
Okay. Are we seeing reinfections?
Yes. We have reinfection cases.
Wow.
Like people who had it the previous waves, hospitalized again?
Not hospitalized, or they will have symptoms, but not necessarily end up hospitalized, but reinfections have been documented in Belize.
Which is why it is important that even though you've had COVID, that you be vaccinated.
Yeah.
I think the CDC is saying now that you may get your vaccine 2 weeks after being cleared of COVID.
Yeah.
So you don't have to wait for 6 months or whatever the case may be.
6 months, right.
So even if you've had COVID, it is important that you be vaccinated. I think that presently the Ministry of Health and Wellness has about 100,000 AstraZeneca vaccine doses available. So there is no excuse not to be vaccinated. There is the hope as well that we will be able to access Pfizer vaccines later on in the year, and that presumably would be for use in the pediatric population.
Yes, yes. Are there children, now that we're looking at children getting sick, are there children that are more high risk than others? Do we know?
Personally, I can't say.
Okay.
I think we have to treat it the same way with any virus that has never been, no one has been exposed to before.
Yeah.
You have no natural immunity to it, and therefore the risk will be there. And as I say again, I have to re-emphasize, there is the unknown.
Yeah.
Yes, they had mild symptoms or no symptoms, but the unknown is what happened in 1 year, or 6 months, or 2 years. If there is developmental delay, if there is other behavioral issues, it's so random. And I wanted to get to say one thing, is that a lot of times the presentation might not be loss of smell, etc. The presentation of a COVID patient would be a stroke or a heart attack. You know, and that's what somehow doesn't get emphasized, or a pulmonary embolism. So this is far more likely to be because you have COVID than if we were to get a vaccine or anything else. The virus itself, as part of the things that it does to you, it's not just a respiratory problem. It's multi-systemic.
I think that the last time we had a medical conversation, they're saying they're seeing COVID affect the testicles. They're seeing COVID affecting just about every part of the body. So it's something we have to be reminded of.
Maybe if you put that out there, more people will be vaccinated.
Well, I think that was the reason they perhaps mentioned it, but no, it's systemic. But let's come back again to the KHMH, because before you took over your role, Dr. Sosa, we had the very unfortunate cases where people passed away in the parking lot trying to access care at the KHMH. What has changed to improve this system so we don't have that reoccur, even if we're having a spike in hospitalization?
Well, there has been a substantial improvement in terms of the knowledge skills, the experience gained, but also we have the very able management of the acting Director of Medical Services, Dr. Adrian Koye. We are very grateful that he has so graciously taken up the position, and it has made all the difference in the world. It's a substantial burden on him and his family, I'm sure, but we do owe him a debt of gratitude. His implementation of the systems and the direction of the people under him have made such unfortunate events less likely to happen. But you know, it's something of being vigilant all the time, and it's a never-ending task.
Well, you know more than anyone else as physicians, people like guarantees. And Dr. Koye, you shake your head when I ask the question, because, you know, what's your response to that?
Well, it's a loaded question. The fact is that Karl Huchner is and has always been very resilient. And we have a lot of unsung heroes, and maybe I am just a manifestation, and I am actually lifted by what I see daily, the efforts that they put in. And Dr. Sosa knows this well as well. He recognized that the talent exists within the organization, and it's just for us to guide and channel them in a safe manner. And so I give credit to the efforts that they make, and I am just a guiding force in all of this, and hopefully respond when the need arises.
So the key thing is the entrance, right? So there's a specific entrance for COVID positive or COVID suspect persons?
There is just one common entrance, and again, it's a matter of how.
Oh, so that's changed.
The triaging, there's a triage point, which is the major change that happened from last year, and that change was in a way to direct patients to what was an alternate emergency room in front of the hospital versus the COVID entrance. But right now, everything is in one direction only. It's simpler, and that's for the simple reason that we are not overrun with COVID as we were once. But also we have strengthened within the flows for the patients to assure that there is always a space available, but the risk is there. And the risk is there simply because we continue to face not just COVID, we continue to face just daily living, you know, interpersonal violence, road traffic accident, and emergencies will happen. But definitely we will continue to make changes that will strengthen again more what we're doing.
And Dr. Sosa, we know that it was disheartening at the time when you actually got so many, what would be the word there, resignations, and there was an appeal for more nurses. Are you getting applications?
Yes, we are. We have been recruiting very aggressively. I think that by the beginning of August, we should have recruited 30 new nurses, both permanent and part-time. So we are making substantial progress, I think. We have been able to count on the support of the Ministry of Health and Wellness. The new graduates will hopefully, nursing graduates I'm talking about, will hopefully come to bolster our numbers. Yeah. Then it will be a matter of training them up to the standards that, that the hospital needs.
That was the challenge, though. The nurses that were leaving had worked in the COVID unit before. Yeah. So now you have a mix of new staff, as well as, you mentioned Dr. Bradley and several others, some who have worked it before.
Yes. Well, it has always been our experience. We have a turnover for nursing from the simple reason that the pull factor is very strong elsewhere. So we invest in them as if they're our own, and we hope that they would stay, but they don't always do. And that's natural, and that can happen. So our destiny as a hospital tertiary for the country of Belize remains that of, one, becoming a center of excellence, which it is in so many ways already, two, a teaching hospital, which it already is, but we have to build on that. It has to be a natural institution where our future health leaders, doctors, nurses, lab technologists, physiotherapists, every category will pass through Karl Kushner. So it will be that incubator or enriching environment that will inculcate certain, excellent ideals and skill sets that will benefit the whole country, because we can't be selfish and have everyone for ourselves. But by their nature of the experience they get at Karl Kushner, then when they are in Punta Gorda or in Corozal or Pakachan, wherever, the fact is that they would have been prepared. And that's what we have to continue looking at, how we build our workforce.
Yeah, I understand.
It's not just getting the title.
The emergency mode put a delay on what was supposed to be a big deal for the hospital, your first kidney transplant?
Yes, the planning continues. Yeah. But yes, we might have to delay a bit, but we will keep you posted as to how that goes.
Gentlemen, we don't know how bad it's going to get. We're hoping that the curfew will help. We're hoping more people will go out and get vaccinated, and that we will all return to being as vigilant with our safety protocols as we were in March 2020. But as the leaders of the institution that the majority of Belizeans will rely on for tertiary level care if they get severe COVID, what keeps you up at night? What's your biggest concern?
My concerns are many, but primarily it is that I would want to see KHMH become a much more independent institution where we have the freedom to procure our medications and not have to depend on the central medical stores. The health system in Belize is a big one, and there are so many different challenges, but Karl Kushner is a challenge all of itself, and it needs to be self-sufficient in many regards. Yes, we have many important partners, but this is where the buck stops, and we have to be able to have the freedom to procure what we need in a timely fashion. That is one of the biggest challenges that we face.
Well, we have to meet our mandate, and we are far away from it from a national perspective, or from a personal perspective, I would say then, because we have accepted so many things over the years, and because we are always close to the issue, we don't really see bigger than. There are a lot of gaps in our health system that need to be filled. Karl Kushner can only do one part, but where it comes to tertiary care, we have to actualize. And part of the reason why I am here where I am, by the request of Dr. Sosa, is because he expressed that vision that we're going to change this institution in a way that will make the country proud. And to actualize tertiary care requires not just talk, it requires investment in people, in infrastructure, but it is worth the investment. The investment will be, the great reward at the end will be that when the need arises for any of us, our population, when our teachers retire and they need care, they would say, at least I have Karl Huchner. I don't have to worry if it's dialysis, if it's Lap-Chole, if it's anything basic. I'm not going to lose my dignity and my savings because I have a healthcare issue. And we owe our population, we owe those people who build this country the level of care that matches the effort that they put in to help our children grow and to make this country turn over. So that's what keeps me up at night. What next? Where and how?
Well, you answered the question I was going to ask you, which was what made you return? Because we know that at one point you had moved away from leadership at the hospital. But
I lead from behind, from sideways. No, the thing is, the point is, let me put it a different way. It's a team effort.
Yeah.
And I'm just one.
Yes.
Of the 650 or the 700 staff. I'm just one. And if all of us do our part, this place will shine forever and ever. Yeah. And that's all I see and hope for.
And there's some institutions I always say we all benefit from. If they're successful, KHMH is definitely one of those.
It's a win-win.
And just before we close, just bringing it back to the situation at hand. Currently we have 6 confirmed COVID-19 cases hospitalized at the KHMH?
Yes.
Yes, and 3 POIs.
And how many?
And 3 patients under investigation.
Okay. Any and you said 1 is ventilated at the moment?
Yes. One is on high flow as well.
Yeah. And you are expecting to see more hospitalizations in the immediate future?
We prepare. That's all we can do, because in the end, all we can look is inward. We can't really look outward and see how many people wearing masks, this and that. Yeah. We are trying to, our nursing director and our operations and all that, they're trying to make sure that they have the right amount of staff.
Yeah.
That they can get to work on time,
you
that we have the supplies, the shifts, because PPEs. Our own staff get sick too. Yeah. And so our dynamic is to keep this engine running, and not necessarily how much and what is happening, but we would very much like that the country on the whole, everyone does their part.
Yeah. We have enough oxygen, because we saw that as a problem in India.
Yes, we do.
Oxygen is not our issue.
Yeah. Oxygen is not our issue. That's a key thing to hear. And are people coming to the hospital in time? Because we know before people were waiting till they were gasping for that last air.
I think for the most part they are. We do get referrals from our district sometimes that are not necessarily referred in a timely fashion. We hope that there's greater coordination, because we're there to provide the service, and we want to receive the patients as soon as is possible, so that the outcome can be the best one. One message I would like to put out is that yes, it's summer, and it should not be a carefree summer. It has to be a summer where we are all very cautious. Indeed. Because that will mark the difference as to whether we have a continuing increase in the numbers or whether the numbers start to trend downwards.
Yeah. All right, Dr. Adrian Sosa, and of course, no, actually Dr. Andrea Sosa and Adrian Koi. That's so good though.
Adrian and Andre.
We want to thank you guys so very much for joining us this morning to put some clarity to exactly what's going on there at the KHMH and how the KHMH can actually move forward. Thank you for joining
us this
morning.
Us.
All right, we're about to take a break. When we come back, the Belize City Council, they'll be joining us. They're on a recruitment drive for a child advisory board. They'll tell us exactly what they're doing when we come back.
The This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Smart continues to expand its internet coverage countrywide to help you live a smarter life.
Our villagers are very happy. They are pleased to know that Smart went the extra mile to put a tower in our village so that our villagers can get live stream on their TVs and they can get their kids doing their online classes. I want to say to Smart, thank you for making it possible for us to get internet in Gardenia Village. We really do appreciate it.
Smart continues to take the internet and mobile services to communities across Belize. Now save even more when you bundle your Smart broadband with Smart mobile services. Smart, bringing people together.
If you have a baby on the way, here is what you need to know about maternity benefit. It includes both an allowance for 14 weeks and a grant, which is a lump sum of $300. The basic requirements are: you must be employed, you must have at least 50 paid contributions, and you must have continuous contributions leading up to delivery. To apply, a licensed doctor certifies the expected date of delivery. The employer completes the salaries record. Submit your completed claim form as soon as possible. After giving birth, submit your continuation claim no later than 3 weeks after delivery. If the mother does not qualify, the father of the child may qualify for the maternity grant. Want to know more about maternity benefit or grant? Visit our website or contact any of our offices to have someone assist you. Also, be sure to visit our Facebook page and give us a like to stay informed. Social Security Board, safeguarding you, your family, your future.
It's time to put your TVs on lockdown. COVID won't stop us this time. After a year of waiting, Summerfest is back, pandemic style. If you're under the age of 18 and you think you have the talent, we are looking for you. Submit videos to us on Facebook, Instagram, and email. Or join us here at Channel 5 on Coney Drive to audition from July 26th to 30th from 10 a.m. to midday. Be a part of Summerfest 2021 and show Belize your talent.
we're back. And we're moving into a second conversation for today. Parents, we told you earlier, if you know that your child has a lot of opinions, a lot of thoughts on what can be better in Belize City, definitely want to pay attention because the Belize City Council is recruiting new members for their Child Advisory Board. And here to tell us more about it, what the children do, how they're going to find them, we have Deanna Riquenya, who is a past youth shadow counselor. And we have Michael Fritz, who is the youth officer and community support officer at the Belize City Council. Good morning, and welcome.
Good morning.
And, you know, you both have official titles, but I gotta say, you know, you're both youth activists too, who've grown into this work as a profession as well.
Right.
Yeah. So, I don't know how much people know about the Child Advisory Board itself. So who wants to start off with giving us that explanation? What is the Child Advisory Board? Michael, you'll take that?
Sure.
What do they do?
So the Child Advisory Body is a group of young people aged 8 to 17. It's a national initiative, meaning that every municipality in the country has an attached Child Advisory Body. The goal of it is highlighting the principle of Article 12 of the Convention on the Rights of the Child, children having the right to voice their opinion. So it's about kind of eradicating that notion of children being seen and not heard. We're bringing them to the table, we're listening to what they say, we're including them in decision making. If it's for them, it should be with them. They should not be excluded. So that is a principle that we're going along with. For Belize City, we're recruiting new members for the CAB. And
what happened to the old ones?
What had happened was that some of them had phased out because
they turned 18.
Because they passed the age limit, which is 17. They are no longer active CAB members. So there is a constant need for recruitment to get the body up and running and to get children's voices heard. So that's what we're at now.
And Deanna, you once did that, right?
No, she's the Youth Shadow Council, which is also in recruitment. Yeah.
Okay. So explain that to us. Talk about your experience having to do this. I mean, to me, it's a big deal simply because as a youth, you actually get to see the wide scope of especially putting out your voice out there. Explain that to us.
So the Youth Shadow Council was launched last year, around the same time, July, and I applied to be a part of it. I was chosen to be the deputy mayor in that program. And we got first-hand experience. We learned about the Belize City Council Act. We did various initiatives. And what I like basically about that program is they give us the youth the power to really make changes within the council and to really get a first-hand experience of what it's truly like to be a councillor, the deputy mayor, the mayor, because we do what they are doing. You know, so it's very moving project that I was a part of, and I was definitely successful because I then joined the party, the People's United Party, and became a councillor, an elected official.
Indeed. Why did
you were the youngest, right?
Yes, I'm currently the youngest female politician.
Why did you sign up primarily?
Well, just like anyone else, as young people, when we're out of school, we don't really have anything else to do. And I wanted to get involved to something moving. And I saw the advertisement and I said, I'll give it a shot. But what was holding me back was the fact that I was a mom at the time, because I do have a 2-year-old son at home. And I still joined. I said, if it's for me, I'll definitely be chosen. And I was called, selected, and you know, I started to do my work as the youth deputy mayor.
And this is what I think is interesting because, you know, a lot of times young people and even children as young as 8 or younger would say, they do have ideas and thoughts that they think will help to build a better society. What this is a vehicle that gives them that chance. What did you learn individually when you became a shadow counselor about being able to impact change even as a young person?
Well, basically, now the era is it is changing drastically. They're giving young people the opportunity to voice their opinion, and that is something very important because we do come with many ideas that maybe the older folks won't have. And Basically, the Youth Shadow Council gives you, like what you said, it's a, you are getting into a car and they are really taking you there.
Nice.
So that is what I
So
do.
it was an opportunity to contribute as a young person for other young people too.
Right.
Yeah.
And what we did in the Shadow Council, we knew what we wanted to see different in our city, and that is what we vouched for. You know, we asked them to collaborate with us and let us do this stuff because it will benefit the younger people. Because the younger folks feel as if though they don't have any representation within local government and central government. So having us showing our faces and really getting involved, they really do. They have hope.
And what are we yielding at this particular point? You did mention that, you know what, they feel they might not have the voice.
Right.
But now yourself, you signed up, you're
Yeah.
a youth, and now you're part of the council. What are we yielding at this point?
Well, for me, I'm the counselor responsible for foreign affairs and sister city relations and public relations and after school programs. So with the after school program, I told the mayor I wanted to take that initiative from paper and pen to really getting the young people involved, building, you know, their platforms, having them getting trained in different areas so they can use those skills to like start a business or something. We don't want to keep it as after school program. And I think that is my portion that I'm giving back to the young people, empowering them through my after school program. So that is something that I am personally doing. But on the city council platform, all the councillors are involving youth in their plans.
So there are two things here on the table, and we want people to know that there is the opportunity to apply as a youth shadow counselor, and there is the opportunity to apply to be a part of the child advisory body. So the distinction for the child advisory body is age 8 to 17. What's the age requirements for the youth shadow counselor?
17 to 29.
17. Oh, nice.
So essentially,
so you got both kids covered.
Yeah.
It's the council making it possible for youth integration. I think it's a very good opportunity. It's putting us on the platform to say that we're serious about youth integration, and we're making spaces possible. It's really a good accomplishment for the city council. It's a good accomplishment, and it should be something that other municipalities follow suit with.
Yeah. Right. Well, most of the other municipalities have the child advisory body, but they don't have the shadow council. So that's the other step.
Yeah, we have seen the residents of their respective areas requesting it. So we'll definitely, if they want to join with us, we always will be willing to share how our structure is worked.
And how's the recruitment drive going so far, and how can they sign up?
So for the child advisor body, the flyer is on the Facebook page, and attached to the flyer is a link. So you can use that link through Google Forms and you can apply. And
is it the child who applies, or a parent can apply for a child?
A parent can apply for a child because there is need for parent information. We're dealing with children, so you have to go about the proper avenue. So you have to include the parent as well.
Yeah, Michael, help parents understand. If they can't imagine their 9-year-old, you know, sitting in a city council conference room, contributing towards development, how do they engage children? How do you get the voices of these children at that age involved?
First of all, it's about making a comfortable space for the children. Letting them know that this is a safe space, and then listening to what are some of their concerns, things that they have been seeing within the municipality, within their communities, and then doing that discussion on how can we fix this. If it's a small step, if it's a big step, if we need to get the bigger heads around the table, then that's what we're going to do. But it's involving them in every single step of the way.
What's it like seeing kids speak out at that age?
It's very refreshing. It's something I have been passionate about. I get all tingly. I'm happy. I am very much a child rights advocate. So seeing Article 12 in living, breathing motion, it brings joy to me.
And what are children saying? What are they saying?
So far, those that I've met are very excited that it's going, getting back some mechanization. They're happy. They see a lot of things that they want to change in their communities, and they want to get working. So very much good feeling so far about the child advisory body.
How many people, how many children are going to be recruited for the child advisory body?
What we're looking at is around 24 to 30 participants.
30?
Yes.
Wow.
Yeah, it's a kind of a big number, but also a small number because then it's the entire municipality.
Okay.
These children will essentially become ambassadors for children, essentially, championing their own rights and their own issues. And it's not saying that we're only going to work with 30 children. There is room for us to expand and to include other inner city children in whatever initiatives the Child Advisory Body does.
Okay.
Right.
And let's talk about the application process for Youth Shadow Council.
Similar to what Fritz said, it's a link. We have a link attached to our page. You can definitely click there, fill out the form. You send in a letter of interest, your police record, two recommendation letters, and your ID.
Yeah. Okay. And it's not taking as much as 30. It has to match the council, right?
Exactly.
And when is the deadline?
How competitive is it?
The end of this month is very competitive because of my journey, many children want to join, many youths want to join, and being that we raised the age range this time around, we're definitely getting some activists within our communities.
What's the time commitment that it takes?
Well, with programs department, they are working on a structure. We weren't so much involved like how this second cohort will be, but it's just different, like workshops. They will be doing a couple outreaches. It's not a lot of time you're dedicating.
Yeah, because they have school.
Exactly,
and
and some of them
work.
will be working.
Yeah. And for the children?
The time involved is about, most of the times it would be after school, getting the children together, but that doesn't mean that that's all they're going to be doing. They're going to be community service projects on the weekends, during the holidays, so there's going to be ample time for children to be involved and for their voices to be heard.
Who's the ideal candidate?
The ideal candidate is any child that is very passionate, they are vocal. The parent might say the child talks too much, has too many opinions, but these are the type of children that we want. They're vocal, and it's about channeling that energy to positive youth development.
Oh, that's so cool.
Well, I mean, let me let you in on a little secret. I was on an advisory committee as a child. It's a wonderful experience, and I had to age out. That's how they got rid of me, from 10 to 18. So it is a great experience as a child to be involved at that level and to be able to get an opportunity to express yourself, as I'm sure you both have learned, because you're advocates who now pursue a career in youth development.
Right.
Yeah.
Right.
All right.
All right. Well, guys, that was short but sweet, because now we know. And again, you said in terms of joining the team, become a member today. Tell them how to join again.
So there's the flyer that's posted on the Facebook page, along with the Google Forms link. The deadline for application is July 28th.
Okay.
So get those applications in on time. Get those vocal kids a part of something amazing. It's a step towards youth inclusion, youth involvement, and children and adolescent participation.
Excellent.
Great.
All right.
And you said the link for the Youth Shadow Council also
is
online,
on the page.
Very competitive, but take a chance. You never know how it's going to
And even if they are not selected, they can always come to the council and offer their assistance.
That's lovely. All right. Well, thank you guys so very much. Michael, Liani, it was great having you in. And now we know the initiative, it's out there.
Yes. Thank you.
All right, we're about to take a break. When we come back, it's going to be some serious cake decorating. And the music should come on. Will Marlene be able to beat John in the cake decorating? We'll find that out when we come back.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's time to put your TVs on lockdown. COVID won't stop us this time. After a year of waiting, Summerfest is back, pandemic style. If you're under the age of 18 and you think you have the talent, we are looking for you. Submit videos to us on Facebook, Instagram, and email. Or join us here at Channel 5 on Coney Drive to audition from July 26th to 30th from 10 a.m. to midday. Be a part of Summerfest 2021 and show Belize your talent.
Es un hecho. Únicamente con Smart obtienes todo realmente ilimitado. Solo con Smart obtienes datos ilimitados en cualquier momento. Mientras que con el otro proveedor solo son datos dobles los fines de semana. Con datos ilimitados todos los días no hay necesidad de esperar, así que es un hecho que nuestros planes ilimitados superan a la competencia. Por lo tanto, no permita que le digan cómo y cuándo usar sus datos. Y obtenga llamadas, mensajes de texto y datos ilimitados. Vive la verdadera experiencia de planes ilimitados con Smart. Es un hecho. Haga el cambio y viva Smart.
Been drinking all night, feeling so high, better not drive, won't even try.
Been drinking all night, feeling so high, better not drive, ain't gon' try. Been drinking all night, feeling so high, better not drive, ain't gon' try. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. People die every day, I'm not going with ya. I'ma find my own way, I'm not going with ya. It's okay, I'll wait. Even good people make mistakes. I don't wanna realize when it's too late. Drinking and driving is never safe. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. Been drinking all night, feeling so high, better not drive, ain't gon' try. Been drinking all night, feeling so high, better not drive, ain't gon' try.
So class, let's review your homework. What are some of the things that we can do to make sure everyone has a clean and reliable supply of water?
Sir, we should turn off the faucet when using soap to bathe, to wash our hands, and maybe even our cars. This will cut our water bills and save us a lot of water.
My dad says we should keep the area around the water pipes close to our houses clean.
Yes, sir. We should encourage our parents to pay their water bills so the entire village will always have clean water.
Right, class. We should not forget to attend water board meetings and add our 2 cents. Make sure everyone has reliable, clean water.
My mom says that we young people can volunteer to paint the public water pipe.
So, how do we make sure we will always have reliable, clean water?
Join the Clean Water Revolution.
Get involved today and do your part to keep your water supply clean and reliable.
The Department of Rural Development is working on achieving Goal 6 of the Sustainable Development Goals, which is to ensure access to water and sanitation for all.
Brianna, what do you want to be when you grow up?
Mommy, when I grow up, I want to be a doctor.
That's great, honey. You have to study hard then and get good grades.
Yes, Mommy, I will. Mommy, why do the neighbors have to play the music so loud?
Every day, people are affected by noise. Noise, like loud music, is not a concern for those making the noise because they are not the ones being affected. It is usually the vulnerable that is impacted the most by noise pollution, such as the sick, the elderly, and the young. That is why the Department of the Environment is asking you to be considerate of your neighbors. Be mindful that your actions can have lasting effects, and know that noise pollution is an offense under the pollution regulation.
Hey, Dad.
Hi, Brian. Please stop running around the house.
Right now, Dad.
Damn it, Brian! I told you stop it! Can't you hear me? Are you deaf? Are you just being
Time.
Back to Open Your Eyes. We're moving now into our third and final segment for the morning, and this one is all about cake decorating 101 by a small business entrepreneur. She is in with us, looking lovely. Her name is Renette Lisby.
You can't run off the set.
And she's the owner of Sweet Little Things by Ren. Ren, good morning.
Good morning.
And how are you?
Nervous.
Well, you are the master and we are the novices.
Yeah. We're supposed to be nervous. What do you think?
No.
So tell us about your business. Tell us about Ren.
Well, I started the pastries like last year, August, when I lose my job. I start from cinnamon rolls, then I got the brownies. I know for the leave it at everything.
Yeah.
Then one day I decided I got to my nails and I got to my nail technician and I tell she about the situation and she recommend I go do a cake decorating class. And I tell her, but I never want to go to the person what she recommend. So she like, oh, this other person, Marcy Sosa, do cake decorating. I was, really? And she give me the information. I text Miss Sosa. And I get my spot in. Because she usually got a waiting list. So when I get my spot in, I gone and that me one hectic thing because when I got there, I don't know if I bake even a cake.
Oh, really? Wow.
Yes.
But wait, you make cinnamon rolls, but you couldn't make cake?
Couldn't make cake.
So, cinnamon rolls are more work?
No, it's less work, but my mom, my grandma, they make cakes and things. So I said, I never interested for learn. So I said, make I try do it. I begged my mom for bake the first time for me, and she said, here what? After this, you bake your own cake. So I said, okay then. So I gone and I get my cake and I start making it. Come to find like when it comes to the chocolate cake, one of the I'm not say the best, but one of the best. And my cake sisters, they love it. I share my recipe and whatever. I get it from my chocolate cake recipe from my best friend, and that's how I do it. I just find the recipe what I like until I I combine my recipes them.
Okay.
But Rem, let's step back for a minute. You know, a lot of people were in your situation.
Yes, ma'am.
COVID hit, and for whatever reason, it could be tourism, it could be the company had to cut down, they're out of work. What was it like for you, and how long did it take you to kind of scramble to figure out what was going to be the next move?
Well, when I got laid off the 6th or the 7th of August, and by the 28th I start.
Yeah.
I say, you know what, when I collect my check, I say, I know they sit down home and do nothing.
Yeah.
So I say, well, I tell my mom. And at first, I never know to make cinnamon roll neither.
What?
So I text one of my cousins and I tell her, like, she say, why you not start? I say, I don't know for that. I say, and she give me, and me, I cook, I do cooking.
Yeah.
So I usually combine recipes. So I combine her cinnamon roll and one where I receive. And I do my own thing and everybody fall in love with it and things. So I start from cinnamon roll, for the weekend, I make $300 off of the cinnamon roll the first weekend.
Yeah.
And I say, you know what, this is it. and I start.
You just take a chance.
Yeah, I just
said,
take it.
Yeah.
Yeah. And then I start and then everybody every week I get somebody recommend something else.
Yeah.
I say, you know what, I want to do it. And that's why I end up doing it.
So you did cinnamon rolls, then brownies.
Yeah. Then I do on weekends I do pizza and wings and those type of things.
Okay.
Just like that?
Yeah.
In Boom.
In Boom, yeah.
Sweet little things. by
And you
Red.
never thought, up till August, less than a year ago, you thought you'd just continue working every day like everybody else.
Well, yeah.
But question,
And
Red.
now you have your own business.
Yeah. Would you say, you know what? I left Sweet Little Thing by Ren and just go back to work. Would you do that again?
In some situations, I not depend on people, but I in order to get my everything I need, I go and I save. And when I see my saving, I say, you know what? I tell my mom, I'm going to look for a part-time job so I could build up back and get whatever I need and things.
Okay.
I don't ask people for things, so I don't never ask. So I rather go work for it, then get it and come back. That's how I do my things.
Oh, look at those coconut tarts. You did that too?
Tell you.
Yes, ma'am.
Look on the cinnamon roll. Oh.
Mm-hmm.
All right.
So then from all of that niceness, you decided to go and learn how to decorate cakes.
Yes, ma'am.
And you said it was hard.
It was hard, yes.
Yeah? Tell us about the process of learning to decorate. Well, first you learn to make the cake the way you want it, and then decorate it too.
Yeah, because Miss Sosa only teach you to decorate.
Okay.
So I gone the first week. Well, I don't never listen. I hear she say putting essence, I putting color instead of essence. I don't know better. So I was the only one with a pink cake, and everybody else we got the.
We taste like without essence.
But it still look good. I she like, no worry about that.
Yeah.
You say you have to know everything.
Yeah.
You get the hang of it and whatever. I say, okay then. Following week I gone, I do good. The third week come when we do a 3D cake. And my cake just made give me trouble. I crumb coat it, one stay and nothing.
Oh my God.
I did half an hour to do this. My teacher watched me. I tell my friend said to me, I said, you know what? I give up.
Yeah.
And I sit down back and I watch everybody and do everything.
Yeah.
And she did think she did watch me. And she said, Ren, no give up. I said, I can't do nothing else. This cake, no one take it. What I want to do. So she was right now when I done it. So I come and I said, Ren, what is the problem? I tell her, Miss, this cake no one take and I don't give up and I do nothing. She was no man, you say go wash your face and come back.
Okay.
Go and wash my face and come back.
Fresh.
She come and she mix the ice for me and whatever. She noticed one stir, nothing neither. So she said, it depends all on the weather and how much you put in or whatever, right? So I said, okay then. She gone and she fix it for me and she start base the cake. So when she start base the cake, she said, hi, now give you trouble. Well, when it done, and I try base it myself, you never give me no lot of trouble and things. He said, sometimes that's just your mind.
Yeah.
Because once your mind not up and do it, you say, you know what, do good. Yeah, so after that, I'm happy. It come out really good, and I'm give away the cake.
Oh. You're trying to bring it right here. But anyway.
None of this one. but so now you do cakes for sale as well?
Yes.
In addition to your other pastries?
Yes,
What's your biggest seller?
It all depends. I got some customers that only depend on cinnamon rolls.
Okay.
Some only depend on the brownies, the chocolate cake, anything in a chocolate.
Yeah.
I got people that ask me like, I don't do wings and pizza since I come into this suburb here. And every weekend they harass me, no pizza and wings and cheese sticks and things like that. I'm like, no, I said, I'm busy. And they're like, oh, you just throw it on Wakana. I tell her, no, I busy. Like, if I not let them walk, I can't tell people no. So I can't let them. I said, but I promise you, by before July, and I will give you one.
Okay. So that's supposed to be this week. Is she ready to come?
Yes.
And now the student, Miss Marcy, to watch right now, they become the teacher.
Yeah. So you're going to teach us. So let's put what you've learned into motion now.
If you can make brownies and cinnamon roll and have them sell out the way you do, you're done the far ahead of me and John.
Yeah, long time.
And your cake and a pot cake, so definitely they're farther than we.
All right, so you ready?
John just learned to make a pot cake, right? Last year.
I don't do a pot cake, but I try the cake from scratch too. Because you get recipes, and then you start putting.
But you did your first cake last year in COVID.
Yes,
we talked about that. Yeah.
Yes, I did, and I felt good about it. It's like oh man, it's an accomplishment. So let's put what you've learned into motion. We've got some cakes here, and you're gonna decorate.
We're gonna do
right?
cupcakes.
All right, so let's do that then. First things first. What do we need to have?
Whatever color you want to put the cake. I bring blue and the yellow will you mix it.
Okay. So that's the coloring.
Yeah, this is the
coloring. Is that the one that you put in the cake the last time?
This I forget. Whatever color you choose for, you always have the icing. Whatever color you choose to put in there.
Okay.
That depends you and what you choose. Because some customers like. They tell you, put your magic. Some are like, no, I want this certain color.
Okay.
So then I just...
All kinds of fanciness. So this is yellow food color powder. And this is pearl sprinkles. This is yellow sugar sprinkles.
Okay.
And this is yellow gel.
Okay.
Food coloring.
Why did you use the gel and not the powder?
The powder mainly go in things like these kind of melt and whatever, because if I put powder in here, make it as shine as the gel. Even with the water,
the
coloring, no, bright.
Okay. So we put this here. Sweet Little Things by Ren. All right, so what are you gonna have today?
Well,
okay, so where do we start? We could start?
Yeah.
Yeah, I you could use this and stir. I always stir icing, yes.
All right.
I thought it was soft.
She done the wind.
It's stiff, so you have to stir it in, make it.
Yeah. Okay, wow, that's tough.
All right, this week.
Yeah, so if people should call you today, what can they expect on your Sweet Little Things menu?
Excuse me?
If people should give you a call today, I mean today that's Thursday. And so I'm sure you'd have some pastries today. What do you have today?
Well, not today.
Not today?
I prepare for fundraising tomorrow.
Cool.
I usually give away stuff like I help out. Like in my community, like sick patients like last time I did for a cancer patient, I sell all my patient and I give her 75% of what I make. Yeah.
Sweet. That's so nice, friend. All right.
Yeah, that's soft enough.
Then we're gonna put it in the bag. Well,
it's soft enough, right?
Yeah, it's soft enough. That is a rubber, so it makes it seem a bit difficult.
Okay.
Okay.
Yeah, they never mean with a spatula. Just saying. Okay. So put this.
Yes, I always put the bag halfway because that's how you can handle it. You can't fill it up.
Oh wow. We're trying here.
It's like big.
All right, yeah, that's too much.
Let's do half.
Just a little bit, yes. Okay. Still big?
No,
it's perfect now. Yeah.
Just
all right, so we'll be decorating. We got 3 chocolate cake and 3 plain white cake. Okay, there you go. Ren, she got it down to a T.
Okay, Johnny, you did that.
All right.
Sharing the work here, right?
All right, so here we go. Ren, we're trying. All right, so there we go.
Test it out in here.
Squeeze it if you can handle it.
Yeah.
You see?
All right, so we good. Is that okay? All right,
Yes.
Mara, good test out. That was not a real. Oh my God.
It must have done.
Move on.
All right, so we're ready and set. We could move these out of the way now. All right, and then we bring the little cakes. We'll take this out of the way here and put this here now. All right, so first things first.
I was show on the first
Okay,
couple do a rosette.
Okay, show us how to do
And-
the rosette.
You always start from the middle, say if I'm a star, and I come right around.
Okay. Okay, so start at the middle. And then you come right around.
Microwave again. You done this thing.
Okay, there you go. Yep. That's okay, man. Look on that. Look on that. Look how nice that looks. See, Marlene, I try to shine me now.
You start center
There
or
you go.
end?
Center.
Center.
Yeah, squeeze on, then it'll turn out. See, that look pretty. That's not fair, though. My goodness. No. And then they put extra on the side. I don't like that.
Okay.
I got this.
This is one of the basic, what everybody always do recommend, like when you got party and things, just to stick like whatever logo, whatever you want
Yeah,
in
right
it.
in there.
And, yeah.
That's the basic one.
Yeah.
All right, watch this. Aw, so cool. Thanks, Mar. You actually nice mind up.
Yeah.
All right, so there you go. I'm gonna try out China. So now we're gonna do a chocolate one, right?
Okay. I'm not showing it.
No, she's gonna show you something else.
Something else.
Okay,
So,
this
guys,
start
are
is,
ready.
they have this star.
Okay, so let's get the star.
I always start at the middle. You go right around.
Okay.
You have to put enough pressure to make you could see, actually see the shape.
Oh my God, that's beautiful though. I like to that one. Like I like that one.
Okay.
Okay.
All right, well, this is because I fixed yours. This is round one, right?
Look, you know.
Round one.
Look, you know.
Thank you very much.
Okay,
Go ahead.
So now with the star.
You want to switch yellow and blue or you're good?
I want to keep the blue.
Okay.
Yeah.
See my old shine me, see?
I'm ready.
Alright, I know how to side. Check that out, man! Alright, let's see
Okay.
your skill, huh?
All right.
All right.
We take that.
Let's do it.
All right, what do we have to do now? Middle first?
Yes, ma'am.
Oh my God, I'm just not liking her today. Look how beautiful that look.
Okay.
Oh my gosh.
All right, so we got. Oh, see, but I missed a spot.
Alright, so I had to win this one.
I never said that.
Okay, well, this is some fun piece I made.
Alright, so we have
Usually, when you've got 6 cupcakes, you decorate 3 with whatever piece it fondant, and then the rest could go anything. So,
Okay, so
3
put
of
it back
them,
on the
yeah.
plate then. That's
Okay.
what
So, I
we'll
don't know
do.
if you want the 2 yellow and a blue or 2
Okay.
blue and a yellow.
Oh, that's so beautiful.
Look at that.
Yeah, so,
That's so beautiful.
You
so
made
decorate-
these?
Yes, ma'am.
And it says, open your eyes.
Oh my goodness.
Look.
With our colors and everything. Oh
Blue
my
and yellow.
gosh. Oh, boy, check that out.
Even the
Over
little,
your eyes,
even the little eyeball in the eye. That's cool. All right.
Yeah, that's so cool. Ren, you, oh my God, you blew us out of the water, man.
Well, when
That was
Sabrina
beautiful.
called me and tell me, I tell her, girl, no, please, sorry, I can't. You know me. And she like, Ren, try it out, and she did it. So and she tried.
Yeah.
I said, but you said we are fun that work. I said, I don't like work it fun that. Cause fun that you have to need it, right?
Okay.
I said, I said, when you come off of the phone, I said, make I go test this out and whatever. I gone,
did.
go up on the page, look everything, and I said, no, what, I want to try.
Yeah.
And I try it out.
And
now
look
it
at
come out.
that.
And you did, and they're beautiful. Check that out.
So this
Open
is
your
fondant.
eyes.
This is
Yes,
edible.
ma'am.
You made the blue part there,
Yes.
and then that is what, just gel,
Gel,
that you used to
yeah.
spot,
Yes, ma'am.
and then you mark in the open your eyes. Yes, ma'am.
Ren, you made our day today. Yes. So again, how can we get to you in case
So
somebody
who win?
wants something? Not be biased now.
Who win?
I don't know.
How you mean I don't know?
Well, you only got thing. I mean, like, if I take this off from here and this, uno could I have sugar. Well, the blue could bring out like a pearl or whatever.
I tell you what, make a nice up one of her one.
Wait, oh, you. Okay.
There you
I'll
go.
work with that. I'll work with that.
All right.
I'll show you what I got.
Look at them decorating trash talk what they happen.
Tell you, take a leap.
But that's not fair no, Marlene. That's not fair. Well, you know what? It's not fair. You're being tough with me.
All right, that's it.
All right, well, check this out. You think that? Check that out. You can't say me no win. No.
I think the pearls have it. I think the pearls have it.
So, Ren, how can we get to you in case we want probably some pizza or some pastries? How can we get to you?
I have my page, Instagram and Facebook.
Okay.
Sweet Little Things by Renz, and I have my contact number 632-7049.
Okay.
My business number.
Okay. Okay, boss. Cool. That's
So,
a
yes.
business number. All right. So again, Sweet Little Things by Ren. You could check you out on Facebook. We can see what you've done, and we could make some orders there just in case.
Yes, sir.
All right, Ren. Thank you
Thank
you
you
for
too.
joining us this morning. Hey, what? We could talk secrets too. Yeah. Ren knew that. You know what, John, you got this.
I know you were really nervous, but we appreciate you coming in and showing these skills. As you said, these are the best. The gel ones are the best ones to get the good color. And once you get the bag,
the piping bag
with the nozzle, you can find
Yeah, well, the tips, it depends on the tip. This is my favorite tip, 1M. But with all different tips, you could do the different designs. And
yeah. And all you do is take it. The pressure is what's most important.
Yes, the pressure. That see, when you not apply pressure, it broke up around the edges. See, not broke up, so that means enough pressure.
Yeah.
Okay.
You know, the moral of this situation is that, Ren didn't know that she could do it. And now she's got a flourishing business called Sweet Little Things by Ren. This simply means that you too can do it. Start your business and make things happen for you. Ren, thank you so very much for joining us today.
Thank you too.
You've been so great. As much as you were extremely nervous at first, I bet you're smooth now, right? Everything all right?
Well, happy 1 year anniversary in advance.
Happy 1 year anniversary.
Because it's last August you started.
All right. Well, that's the way it is. But we've got to take our final break of the morning. When we come back, we'll be wrapping things up. Stay with us. We'll be back.
"2020 taught us the importance of being connected to the virtual world, and NextGen is here to keep its commitment to you. Even if you're physically apart, NextGen keeps you digitally connected."
Okay, everyone, thank you for following me today.
NextGen provides more than just an internet plan. They provide service plans that support all your online needs. Sign up today and get your NextGen's ultra high-speed internet service. NextGen, powered by Central TV and Internet.
Why, Tony?
Boy, Keith, what you going on, man?
We actually come see you because I need to buy a stack of them plastic plates and cups for my grocery shop because I run low.
Boy, I stopped importing that thing since April 15th, you know. And I just routed the last batch, must be about like 3 weeks back, you know.
Man, do I usually have anything? What are you going on?
Check this, right? Under the new law, we ban all single-use plastics, so that the cups, plates, forks, spoons, and knives, all of that. Since April 15th, can't import none of them. Starting January 15, 2021, you can't manufacture them. April 15, 2021, you can't sell them. And after July 14, 2021, if you get catch with any other thing, you will get fined.
Me never know this. I guess I have to make some changes then. I have to make the customers know that anything not available. Anyways, bro. Thanks, man.
No problem, man. Take care.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's time to put your TVs on lockdown. COVID won't stop us this time. After a year of waiting, Summerfest is back, pandemic style. If you're under the age of 18 and you think you have the talent, we are looking for you. Submit videos to us on Facebook, Instagram, and email. Or join us here at Channel 5 on Coney Drive to audition from July 26th to 30th from 10 a.m. to midday. Be a part of Summerfest 2021 and show Belize your talent.
Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health.
And we're back. We had a great time, Marty.
Yes. And there's cupcakes.
Yeah, there are cupcakes right here in front of us.
Beautifully
right
decorated,
now.
you know, by these very talented cupcake designers.
Definitely. But while we've got the cupcakes...
Giveaway alert!
Yes, that's a giveaway alert indeed. So we have a giveaway, and it's going to be a beautiful cake.
It's not our cupcakes.
Yeah,
that's the first thing we gotta tell you. Yeah.
You want to get your own. Actually, you're going to get a cake if you win. So what you need to do is to get to your phone or get to your tablet and go on down to our Facebook page. Open Your Eyes BZE. That's where you go because that's where we're going to pick the name from. The first person to answer the question will be walking away with a beautifully decorated cake by Ren. All right? So she's doing her thing. And
she's
you ready?
Decorating that beautiful cake. I think we were supposed to do that, but she realized our skills weren't up to par. So she's going to be decorating it for you.
So I know by now that they're ready.
So you're in front of the computer, the tablet, or the phone on Facebook.
Yes.
Open Your Eyes BZ.
Yes.
Live stream.
Yes.
You're hearing us again.
Yes.
And now you're going to write that answer. The question to be the winner of that cake. You must comment in the live stream.
The question is, what's the name of the business? That's all you need to do. Just tell us what's the name of the business. The first person who answers correctly on our Facebook comment, then you're the winner. And it's that easy.
Yeah.
Easy peasy.
Even do a bigger favor, you could tag the name of the business if you remember it, right?
Like the page.
Let's see.
You could do all of that.
All right, but we got to say thank you to everyone who joined us this morning.
Yeah.
Let's start off with a very serious issue, of course, looking at what's happening with COVID-19 in the country. Getting an update from Dr. Andre Sosa and Dr. Adrian Koyi from the KHMH. We know that they have shifted to emergency mode as of last weekend. They are seeing active hospitalization for both people who are confirmed COVID positive and people under investigation. So it is, of course, a very critical time for us to be aware that COVID is still very much present, that it still very much poses a threat to people, and that you can, the most important thing to do is to maintain your safety protocols and get vaccinated.
Excellent. And we also want to say a big thank you to the Belize City Council. They were in here this morning, and we had a great time with them. Belize City Council recruits for Child Advisory Board, and also a Youth Shadow Council. And the success of that is actually one of the counselors who were in here with us this morning.
Yeah.
That's Deanne Rekena. She's now part of the council. She's a city councilor. She was voted in. And so that's what they've got going on. So
it's a
you
great
can
opportunity. They're looking for 2 age groups, right? So they're looking for 8 to 17 to be a part of the child advisory body. And that's going to be a group of children who help to guide the councillors and mayors on things that will make the municipality even better for children. Then there's also the Shadow Youth Council. And those are going to be people who are going to be shadowing, literally, the councillors and the mayor and deputy mayor as they do their work. So 2 great opportunities. That age group is 17 to
29.
29, right?
17 to 29, and that's it right there. And of course, we want to say a big thank you to Ren. Ren, you came in here and you swept us off our feet by decorating some cakes.
Sweet little things by Ren. That's the answer.
I just want for you to know that she just whispered to me that I won.
No, I didn't see it. It's not true. So, I didn't see it. They didn't say it on air. Right?
Ren,
it's not true that it's on TV.
Thank you. I appreciate it. Sweet little things by Ren. She didn't know she didn't know nothing about this a year ago. And a year ago she learned, and a year now she's got her business. So we want to say congratulations to her. And we're about to dive directly into these cakes. But we've got the winner.
I got to say, yeah, so, you caught me laughing earlier because we got the name of the winner. And we actually guessed it. So, we've never met you before, Loida, but clearly you are a big fan of the show because we know that you are always participating in all of our giveaways.
Yeah,
so thank you for being such a dedicated viewer. And once again, you are our winner for today.
Loida Johnson, man, she's the winner.
Yeah.
That's a good friend of mine, by the way. But thank you so very much.
So you watch every day because of you?
She watched every day. You there every day. But thank you so very much for joining. Thank you so very much. Without you, this is not possible. We're glad that you're able to open your eyes and starting your morning right with us. So if you've got any questions, any concerns, you could drop us a line at oye@channel5belize.com.
You can find us on Facebook at Open Your Eyes BZ and on Instagram at OYEBelize. And remember to tune in tomorrow morning at 6:30 when you open your eyes.
Start your morning right. As per usual, keep your eyes, your mind,
and your heart open. We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.